Hello, my name is Sharon. I'm an accredited lymphedema practitioner, and I'm making this video today about lymphedema with everybody in social distancing and isolation. You might be going through breast cancer treatment, and it's very difficult to get in to see the health care providers that you need while you're going through this. So this video is going to be about lymphedema to try and give you the information that you need to help arm yourself with that information. The more you understand, the more aware you are, then the better equipped you are to handle what's going on at the moment. So just to start off with, what is lymphedema? And I'm talking about breast cancer related lymphedema. If you've had surgery for breast cancer, you may have had some lymph nodes removed from under your armpit, most likely. When that happens, it means that you may experience some fluid building up in your arm or maybe even your breast. Now, why does that happen? The lymphatic system is made up of a whole lot of vessels that are in our body everywhere, and what those vessels do is they carry the fluid along out of our limbs, out of our tissue towards our lymph nodes. When it gets to the lymph nodes drain the fluid, taking out any viruses, bacteria. Your lymph nodes are part of your immune system. The fluid then travels back into your circulation, and your body then deals with it. It might urinate it out, or it just carries on circulating through the body. So why does lymphedema occur? If you have a lymphatic vessel that is draining fluid out of the arm and it comes up to the armpit and it can't find its lymph node because that lymph node's been removed, then that fluid is going to come back into the arm and try and find another pathway out. So think about a busy highway. It's congested, cars start diverting off that highway, trying to find the back road or a side street to get onto another main road to try and find a pathway out. If that fluid can't find another pathway out, it's hanging around in the arm or the breast for a bit longer. And then what happens is the pathways that are working, they're under more pressure, they start to get a bit fatigued, they might start to stiffen up, they become less able to move the fluid as well. So now we're getting more fluid accumulating in the arm. So it is really important, if you've had lymph nodes removed, to think about, okay, what is your risk? So what we know from the research is that women who've had 5 or more nodes removed, that puts you into a slightly higher risk category. If we add radiation therapy to that, so radiation in particular to the nodes, and if you're overweight, if you're carrying a lot of extra weight, that's another risk category for lymphedema. So does everyone get lymphedema who's had lymph nodes removed? No. So as I said, the main risk categories are 5 or more lymph nodes. The more lymph nodes you have removed, there is a higher chance that you might get lymphedema. But not everybody will. So again, it's just about having that understanding about what it is, how it occurs, what can you do to prevent it. So before we talk about prevention, what are the signs and symptoms that you might feel? You might notice that your arm feels heavy. There might be a little bit of fluid accumulating in the arm, but it goes down overnight. You get up in the morning, it's feeling better, so you don't think anything about it. You might have a look at the back of your hand and compare the veins, the tendons. Can you see them as clearly in both hands as both the same? If one you can't quite see as clearly as the other, is that because there's a bit of fluid there? Do your rings feel tight? Or if you're wearing a shirt that's got an elastic on it, does that elastic leave a mark on that arm compared to the other side? So there's some of the signs and the symptoms that you might feel. It often comes on gradually, so you may not be aware of it, but that's the key. We've got to get it early. So can we prevent lymphedema? So the good news is yes. We now have the technology that we can actually screen for lymphedema, which means we can pick up really early changes in fluid within the arm. And if we see those changes, we can treat it straight away. We prevent that progression of more involvement of further lymph vessels. However, again, in this time, you may not have access to that technology. Your therapist may not have access to that technology. So again, it's just about knowing the signs and symptoms. If you feel any of those, you get onto it as early as possible. So what can we do to help prevent it? So the first thing is looking after your arm, skin care, making sure you moisturize your arm every day. So your skin is the outside barrier to the world. So we want to keep that skin as healthy as possible. If you do get a cut or scratch, then you're going to treat that straight away, antiseptic, just try and settle it down. Try to wear long sleeves if you're a gardener. If you're outside, try not to get sunburnt. So just protecting the skin. Really, we're looking for anything that may create an inflammatory response in that arm or breast. So, if we got a cut and that got infected, that would increase the inflammatory load on that arm, which brings more fluid. So that's what we're looking for there. What can we do to help? We can exercise. So we know that exercise is really important and can help prevent lymphedema. When the muscles move and pump, that actually helps to pump the fluid out of the arm. So you don't want to not use your arm. You want to be sensible. You don't want to go lifting a heavy mattress or doing something that could cause harm, but you do need to use your arm. And a individualized weights program that your therapist can provide you can be very beneficial in the prevention of lymphedema. So we've got skincare, we've got exercise, we've got massage. So we can do lymphatic drainage. We know that that also really helps in the prevention, but also the management of lymphedema. And if you want some more information on how to do that, just touch base, send me an email, and I'll send you some videos on how to do self-massage of your arm or your breast. So, skincare, exercise, massage. If you do have lymphedema, then we need to add compression to that. So, a medical compression sleeve. Again, your therapist would need to measure you up for that. However, if you can't get out, you can't get to a therapist, we can offer telehealth consultations where we can show you how to measure and then advise you what kind of garment sleeve is going to suit you best. So, we've talked about who's at risk, we've talked about signs and symptoms, we've talked about prevention, how to manage it. They're the main things that I wanted to cover today. As I said, it's really important to be aware, not alarmed. The more information you have, the more you can start to, work with what you need to and seek out help if you need to. So I hope that has helped. If you have any questions, then please get in touch. As I said, we are offering telehealth. There's a lot we can do via a teleconference call to assess you, to see what's happening and start to put in a program of management if you need it. Thank you.